You can see here on slide 21 the different colors of the tubes. So you will have yellow, light blue, red. Your SST can be a marble color, it can be red and yellow, kind of a combo. That's a common one. You'll have a gray tube or PST. You'll have green, lavender, and I will show you all of these tubes in class. Again, the color helps associate which additive is used. As far as hematology, that's a common lab test as far as it's a department in the laboratory. Hematology is the study of blood, and so often they're looking at a CBC, complete blood count, and they separate all the cells within the blood count and can help determine your iron levels, your white blood cell levels if they're looking for infection, your hematocrit, your eosinophils, which trigger allergies. There's a lot of things, so often you'll do a CBC when you do a blood draw. Here on slide 23, it explains the different type of red blood cells and why we do a complete blood count, and what the standard value is and what it may mean or what it can indicate if there's an issue in the result. Types of needles and supplies, again, we alter that by each patient. So if you have a pediatric patient, you're going to use a smaller needle. If you have a geriatric patient with scar tissue, you may use a smaller needle or a syringe. And so it all depends on each patient. But typically every lab is stocked with different types of needles, different gauges of needles. That way we have options and can choose based on the patient. This is on slide 25, this is a Vacutainer blood transfer device. And that's where if we draw from a syringe, we need to transfer into the tube. I will show you this in the laboratory so you can see. Slide 26, again, is a butterfly needle, winged infusion set. As you can see, the tubing is different here. It doesn't just go straight to the hub. The blood will flow through the tube and then go down the tube into the hub, which will provide the blood into the tubing, the correct tubing that you need. So it's a different technique as far as doing these draws, but there's benefits to it. Again, it's a smaller needle. You can let go once you're in the vein and pop your tubes on and have another free hand. Some people hold on to the wings the whole time. It all depends on your personal technique. But this is a smaller gauge, and so typically we use this in certain situations. Needle safety, very important. Needle injuries can lead to serious or fatal infections with bloodborne pathogens such as hepatitis B, hepatitis C, or HIV. The best practice for preventing a needle stick after phlebotomy is to use a safety engineered sharps needle where you'll have a safety click, which is standard now with every needle you have, where instead of putting the needle straight into the sharps container, there's a safety that you click right over the needle immediately after the draw. That way there's no risk for injury. I'll show you this in the laboratory as well. Examples of needle safety devices. You have your one-handed Vacutainer needles. That's typically what we use. And so there's less back and forth. You only have one hand attached to that needle at all times. If you're right hand dominant, it will typically be your right hand. If you're left hand dominant, it will be your left hand. But that way there's no transfer of the needle, open needle, between both hands. The safety devices, again, I'll show you in laboratory, but very important that you immediately click the safety. Butterflies have a needle safety lock, and so it's just a slightly different process as far as putting the safety on, but very easy. Again, that's your first thing after a draw. There's also a push button butterfly safety device. You typically don't use those as frequently, but I will show you these needles as well. Steps to protect against needle sticks. Do not use needles when safe, effective alternatives are available. Obviously, we want to stay away from using needles, but we have to in phlebotomy, and so the needles with the safety device is always preferred to protect ourselves as well as our patient. Never recap a contaminated needle. Very, very big one here. You definitely don't want to do that. Once a needle has been used in a patient, it is therefore contaminated and can transfer disease. And so if you want to recap a needle, just put it in the safety and put it in the safety sharps container and get another needle, because you don't want to recap. There's risk for poking yourself. So when you put a cap over a needle, you're using 2 hands. And again, we want to use 1 hand with the needle at all times. That way there's less risk for injury. Plan for safe handling and disposal before beginning any procedure, meaning have your sharps container ready and nearby. And if you're using a needle without a safety device, be extra careful that that sharps container is the first step you go towards. Post-exposure management of needle sticks. So wound inspected and washed for 10 minutes with antimicrobial soap or antiseptic. So if you do poke yourself, make sure and wash for 10 minutes with the appropriate soap. You need to immediately report it to your supervisor, and there's typically a report that would be filed. You have to let the patient's physician know, as well as your physician, that there's been a stick. And there will be testing after if there is a stick, there will be testing that needs to be done to make sure that there's no active disease. Preparing for the venipuncture. You'll have the patient sit down or ask them to lie down. It's very important to ask if they have any difficulty with blood draws. The last thing you want is a patient in an upright position and have them fall over on you. So it's very, very important if they do get lightheaded to be able to lie them down and make sure you're safe and they are safe as far as any injury that can occur by falling or a syncope, which is passing out. As far as the tourniquet, 3 to 4 inches above the elbow. Again, it depends where you're drawing from, but you can use your fingers as a guide, but you'll get used to this as you do more draws, and you want the patient to make a fist. That will help pop up the veins, and then you can palpate and find the appropriate vein. As far as performing the venipuncture, first thing you do after you locate the vein and you apply your tourniquet, you locate the vein, then you release. Then you get everything needed. You always want to go in knowing what vein you're going to select. So it's good practice to put the tourniquet on, feel for the vein first, then release and get all your equipment ready. That way you know what type of needle to use, and you can double check your tubes and have everything within hand's reach for the draw. Then once you have everything set up, you will reapply the tourniquet, put your gloves on, you'll cleanse the area, and have a patient make a fist. You then anchor the vein and insert the needle at a certain degree depending on what type of needle you use. Typically it's a 15-degree angle. Then after you anchor the vein, insert the needle, you apply the tubes. So you push the tube onto the rubber end of the needle, which is inside the hub, and that will suck out the blood. And once you successfully get the blood into the tube, that means you're in the vein. You keep your hand steady and you release the tourniquet, and you can apply more tubes if you like. Once you're in the vein, you'll stay in the vein as long as you don't move. But once you're done with the draw, first thing before you remove the tubes is to release the tourniquet. You don't want that added pressure when you're actively in a vein due to risk for hematoma and excessive bleeding. As far as completing the venipuncture, you'll take the tube out, you'll invert several times, typically 8 to 10, then you'll place it in the rack. It's very important to remove the needle quickly and apply pressure. You don't want the patient to get a hematoma, which is bleeding underneath the skin, and you also want to try and risk exposure to yourself as far as bleeding, And so having that gauze nearby, you want to apply pressure, not over the needle, but right as you pull out, you apply pressure and then wrap the wound. If you notice your patient is pale, they're sweating, they're nervous, what should you do? In that situation, you should talk to them, let them know that it's okay. You can lay them down if they feel faint. If they do faint, you may need to lay them down and lift their legs so they can get the appropriate blood flow back. Also, you can supply them with a cold pack. You can wet a paper towel and put it over their forehead, offer them water. If they are not coming to, we always have smelling salts that you will have within reach to where you can use those. I'll show you that in class, how to use them, and that will typically wake the patient up very quickly. It's always important to let your boss, or if you work under a doctor, let them know if there is an issue or a patient does pass out and you're unable to help them. It's always good to reach out and let a coworker know somebody has fainted. As far as the winged infusion set, which is the butterfly needle I touched on earlier, the most common time we need to use this needle is for children and elderly, just because their veins are much smaller. This can also be nice for patients that do pass out. They're afraid of the needle. It's a smaller gauge, and so typically less pain. However, it does take a little more time, and so that's where understanding your patient and the situation is very important. You always use a butterfly needle in the hand. So when you draw from the hand, it has to be a smaller needle, obviously, and you need to go in at a different angle, and so therefore a butterfly would be used. Problems associated with venipuncture, hematoma is the most common, and that is a bruise underneath the skin. However, sometimes the bleeding can continue underneath the skin and cause swelling. And so if there is a hematoma that starts to form, you want to immediately discontinue, take the needle out and apply pressure, then ice. Another big problem associated with phlebotomy is syncope, fainting. Again, a lot of people are nervous getting their blood drawn, and so it's a common, well, not too common, but can happen where people pass out, and that's where having the appropriate position, having them sit up, but being able to lie them down, making sure they're not going to fall on you and cause any more injury with the needle is very important. So always be aware of how your patient looks. If they look faint, then talk to them, and you may need to discontinue the draw. Nerve damage, it's uncommon. Again, with that basilic vein being so close to the ulnar nerve, we need to be extra careful. So we try and avoid the basilic vein and blind probing. Blind probing as in taking the needle, not knowing where you're going, and just going in for the draw or moving the needle around. We always want to stay away from that as there's a higher risk to a nerve. Rejected specimens. Why would a specimen be rejected? Now, as far as thinking back, hemolysis, that can, what that is rupture of the cells to where it can alter test results. And so a specimen can be rejected due to hemolysis, and this is where appropriate handling is very important, and using the appropriate needle for the appropriate test is also very important, as well as inverting without shaking the tube, slightly inverting at a slow pace, and proper handling. Sometimes we have to do a specimen recollection. If we didn't label the tube appropriately, if there's an insufficient quantity, a defective tube, incorrect tube used for the test ordered, which can happen, and this is very important to understand what laboratory you're working for and what tubes they like to use for certain tests. Hemolysis, which is damage to the blood cells. Clotted blood in an anticoagulated specimen. So if the blood clots in a tube that it has an anticoagulant, you may have to recollect. And then, of course, improper handling. So this is just the basic overview of phlebotomy. I look forward to meeting all of you. This is your week 1, day 1